It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
Good morning, everyone, and welcome back for another episode of Best Docs Network. I'm your host, Carla Macias. The next 30 minutes, we're going to take a look at some of the best doctors here in the Houston area, as well as some of the procedures that they offer. Now, what a better way of starting today's show than by learning about one of the best hospitals in the area, Houston Northwest Medical Center.
At Houston Northwest Medical Center, our story began 40 years ago when a group of doctors took the risk of building a hospital in the middle of a cow pasture that was at the northwest side of Houston.
As a result of their vision and the quality that they provided, the hospital quickly grew into a regional healthcare provider serving not just the immediate area, but really all of North Houston.
When I joined the hospital 23 years ago, the things that stood out were, number one, the facility itself. The facility was second to none with respect to the services it provided.
Houston Northwest Medical Center is well known for the high quality care it's given since it's been opened. Since the first cardiac procedure in 1984, the hospital has continued to grow.
We do every kind of surgery, from the small to the large. We do from toenails to open heart. We have a very large bariatric program. We did about 500 cases last year.
As the years have gone on, we have been known for cardiovascular surgery. For cardiology procedures, we have a beautiful cardiac cath laboratory. Our OB department has just grown through the years.
Here at Houston Northwest, we have a lot to be proud of, not only in the quality of services we provide, but in the scope of services we provide. We are the third largest ER provider in the greater Houston area, and we're the largest outside of the medical center downtown.
The attention to detail is phenomenal, from the top all the way down to the bottom. We care at every aspect, whether it's quality, compassion, patient satisfaction, and we don't stop till we make sure that our patients are taken care of.
We have excellent staff, excellent doctors. Our nurses have all gone to do advanced certifications.
The nursing staff here are experienced from 1 year to 40 years in terms of providing women's services care. So we pride ourselves on family-centered care.
In the past 23 years since I've been a physician at Houston Northwest, the hospital has grown with the community. And we continue to perform well with respect to quality, and it's a reflection of not only the physician's care, but also the nursing care in the hospital.
Our facility strives to be a leader in technology, which means that we want to be innovative and we want to provide the best care to our patients. That means the fastest care and getting you the service that you need.
I'm really proud to be a part of Houston Northwest Medical Center, and I know in the future that we'll continue to keep up with the highest, most innovative care.
I'm very excited to see what the future will hold. I know that for this hospital, we're ever evolving and improving.
Where we're headed at Houston Northwest, I think, is as exciting as where we've been. First and foremost, we're going to continue to provide the highest quality of care that we can possibly provide.
At Houston Northwest Medical Center, our story is your story.
At Houston Northwest Medical Center, your story lives on.
Laughing not only eases stress, it promotes social bonding and lowers blood pressure. It may also boost your immune system, so bring some humor into your life.
Well, I had some reoccurring wounds on my legs that just wouldn't heal. It seemed to be worse in the wintertime. Well, I had had them probably on and off for a couple of years, but it seemed to have gotten worse in the end of 2011.
Many of the patients that we see that have wounds have had them for many years. On several occasions, we've seen patients that have had wounds more than 20 years. They typically are getting seen at wound care centers or getting treated by a variety of other healthcare providers without success. These wounds occur on the legs. They are frequently very painful. They are not associated with diabetes, which is a common misnomer. They're caused by venous insufficiency or varicose veins.
I had gone to a local hospital, to a wound center, and spent about a month there doing different things, going back every week, and it was no different. And I decided I was just wasting my money there, so.
He came in, we performed a venous Doppler ultrasound on him, diagnosed venous insufficiency. We corrected that venous insufficiency on him using endovenous radiofrequency ablation of the vessels, and all his wounds healed up very promptly, less than 2 months. In fact, some of them were healed within a couple of weeks.
You know, he seemed to have a little bit, better idea what it was. It was a circulation issue as far as the veins, and he talked to me about the different veins that they could do as far as the closing off of things, and I was all for it. He said that, he thought it would heal up within, no time, and he was correct.
Treating those veins results in relatively rapid resolution or healing of the wounds. Probably the #1 reason why I began to specialize in the treatment of venous insufficiency was that I discovered that it was the solution to these chronic wounds that had previously not been treatable.
Seeing Dr. Morgan, he was very personable. He's easy to trust right off the bat, knew what he was talking about, very friendly staff. Like I said, I've never had any issues since, and I've been very happy with the experience.
BestDocsNetwork.com helps you find the right doctor for your medical needs. Watch videos on each doctor and decide for yourself who fits you best. On the Best Docs Network homepage, you can see the latest videos, search for a doctor, find educational content, and watch the latest TV episodes from each BD and market. If any of you ladies have been curious about hormone therapy, then this next segment is for you. Dr. Sakina Davis practices wellness medicine here in the Houston area. Now let's listen as she discusses hormone replacement therapy with her patient.
Lethargy, just tired all the time, anxious, couldn't let my mind relax, paranoia, and the paranoia was the thing that was destroying me. I just doubted everything that was said to me. I didn't think I was being told the truth. I was looking for anything I could find to prove that something was wrong in my marriage. I was completely convinced that I was headed towards the end and trying to figure out my life.
Samantha came in with mood challenges. She had a lot of issues right before her cycle, about a week or two before it happened. She would definitely notice that her moods would change. She would have more irritability, more anxiety.
From the moment she told me she could help me, I think my mind already changed a little bit. Was I skeptical? Yes. But when I started taking the hormones, which is just progesterone, I honestly believe it was within like a week or two that everything started to change.
Around the mid-30s, or even after we've had 1 or 2 children, we certainly notice a decline in how we feel, and that starts the imbalance of how our hormones start to change. And so during that period of time, we get a phase called estrogen dominance. So if we're able to take that progesterone and rematch it to the estrogen, we are able to correct the heavy periods, the PMS symptoms, the bloating, the irritability, the anxiety.
Oh, it's been over a year that I've been better, and I will never go off of these hormones if I can help it. I know people think, is this a short-term fix? Once I get better, can I stop? And I've been told that no, this is it. These hormones aren't going to come back naturally. You have to continue, and I'm okay with that. I'm perfectly okay with that.
So we can have women who literally can't leave their house. They're so anxious, they're so depressed, they have so many mood challenges. And with progesterone, we're able to completely correct that. Samantha, once she was treated, her whole life was completely different. She was able to function so much better, her family was much happier, And really that made a huge difference in her ability to continue to function as a normal human being. I mean, she's able to just go out there and do what she needs to do and not have to worry about these severe mood swings anymore.
To find a doctor on bestdocsnetwork.com, you can search by your location and the doctor's specialty. From there, you can search through the doctors listed. You can even search by your current location to find the doctor closest to you. Brushing your teeth is not enough unless you plan to spend your later years eating yogurt and applesauce. No matter how long or how much you brush your teeth, you are missing a good portion of their total surface. The dangers of not flossing can go beyond hygiene. The bacteria that lingers can increase your risk of heart disease, so if you don't floss, start today.
The ideal patients for dental implants are ones that have been through lots of restorative procedures, and where these procedures that just aren't predictable. And so we were able to give them their third set of teeth with the use of dental implants.
I had an accident when I was 10 years old, and I fell down on my face and I dislocated my jaw. And I didn't know that then, but I started looking for the oldest doctor or the one with 35 years or more of experience. So I went to the facility on Gessner and I saw Dr. Metz, and they said, this is the guy who's gonna have to be working on you. I had to decide if I wanted to go through with it, and I did research. He graduated top in the class.
So in Tico, we were able to move his upper jaw forward and set his lower jaw back so as to help line up his skeleton so that his teeth meshed together well. We, as specialists in oral surgery, are uniquely qualified to provide these procedures.
I just figured out this is the best facility, this is the best doctor, and I truly believe that, you know, Dr. Metz and his team, they know what they're doing.
These patients, when they come down the hallway, when we see them after this procedure, we see their level of confidence has gone up tremendously. We can tell by the smile on their face as well as their dress. They're dressed sharply and they're holding their chin up. You can certainly tell that they are happier individuals afterwards. Technology today has really revolutionized how we practice implant dentistry. We have cone beam CTs, which allow us to take a CT of the patient in the office, and in about 20 seconds we have 360 degrees of bone around the implant. So we know ahead of time whether we need to graft and also the type of grafting that we need to do ahead of time. So patients are better prepared for the experience and know more of what to expect afterwards. We're able to do this in a safer fashion. And it's much more rapid. The procedures are much more rapid, and the recovery is much easier as well.
If you're still curious about any of the doctors you've seen on today's show, head to our website, bestdocsnetwork.com. Now, one of those doctors you can find on our website is ENT Dr. C.T. Nguyen.
My symptoms were like I would always wake up in the middle of the night, having short breath, and then on the baseball field, like I'd be the one bending over all the time. I was the only kid on the team that would always be slouched over, trying to grasp for a breath. And I would say that was my major symptom right there, my major problem.
Aaron is a young athletic teen whose mom brought him to see me because he was never been able to breathe through his nose. He feels tired all the time, and he complains that he doesn't have enough oxygen. He feels like he's short of breath.
I've been to several different doctors around Houston, and they've always thought it was asthma or something else, but Dr. Nguyen has taken his time to actually look into my nose and go further into seeing what was wrong with me.
When I examined Aaron, I noticed that he has a severe deviated nasal septum combined with enlarged turbinate. The turbinate are the swelling part on the side wall of the nose, which contribute to more than 75% of his nasal obstruction. We discussed those findings with his mom and him and decided upon a plan of treatment that consists first of correcting his septum and using energy radiofrequency coblation to reduce the swelling on the side wall of his nose, therefore increasing his nasal passage and increasing his oxygen intake.
2 months out of my surgery, I feel like I can breathe a lot better. It feels like my performance in baseball has improved. It feels like I'm getting a really good night's rest every night. It just seems really amazing to finally get that breath of air that I've always needed.
Aaron's surgery was performed in an outpatient surgery center. The procedure took around 45 minutes and Aaron goes home the same day.
Dr. Nguyen has forever changed my life. From when I was born to now, I could not breathe and now I can. We just appreciate what Dr. Nguyen has done for my life.
Don't skip breakfast. Fiber in the morning means less hunger in the afternoon when you most likely feel tired and gorge yourself on sugar. An early start on eating also keeps your metabolism more active throughout the day. Breakfast eaters are thinner than most people who just rush out the door.
I had a double mastectomy, and they needed to round out one of the breasts with more tissue. So they took it from my stomach.
She'd always been bothered by her stomach. Her stomach was kind of bulging and out of proportion to the rest of her body. And she thought, you know, I went through this trauma with the breast cancer. Now it's time to do something nice for myself. And so she elected to go ahead and have the tummy tuck to improve the shape of her stomach.
I've had 4 children, 2 naturally and then 2 cesarean. And you start to get a pouch and scar tissue buildup. So, you know, I'm gonna look sexy again, feel sexy.
A tummy tuck can really benefit a wide variety of people. Usually it's what we see is women who just have extra loose, saggy skin in the abdominal area. Oftentimes it's either from pregnancy or from weight gain. They've tried dieting, they've tried all the gyms and working out, and they still have that just loose, saggy skin, or that little just pooch or bulge in the lower abdomen that they just cannot get rid of.
The difference is looking at myself and not seeing a stomach protruding, where I can put on clothes and I feel good. You know, I feel sexy. You know, I can wear a bikini, where I couldn't do that since 4 children ago. So, you know, it just brings that sexiness back.
She had a dramatic improvement. Before the surgery, she had just a very thick layer of fat on her stomach. She had stretch marks, loose, bulging skin, pretty much all around her entire waistline. After the surgery, we were able to remove a great deal of skin and fat and give her a nice, smooth, flat contour. A great deal of the stretch marks were removed. Everything was nice and firm and tight once again.
Oh, after having 4 kids, I've always wanted to have a tummy tuck. I just, you know, I wanted to get back to me. I got my sexy back.
Each doctor on the Best Docs Network website has their own profile page where you can watch videos on the doctor, read info on their background and training, find their office locations and directions, as well as ask the doctor a question and request an appointment.
Let's talk about gluten sensitivity. You hear a lot about that. People with gluten sensitivity tend to get bloating, gaseousness, but it also can cause things like anemia or fatigue because it washes out your nutrients in your body and causes changes in everything from your energy level to your tests in your doctor's office. Gluten sensitivity is caused by the absence in your small intestine of an enzyme that digests gluten. Gluten is like wheat, breads, and that kind of thing, and starches. If you don't have that enzyme, you build up gas from all the gluten that we tend to get in our diet. How can you tell if you're gluten sensitive? Well, one way is to just take gluten out of your diet. All you have to do is look on the internet and you'll find gluten-free diets. If you get better from your symptoms that worry you by being on a gluten-free diet, then you probably do have gluten sensitivity and just keep on keeping on that way. Now, one way to tell for sure is you can get a biopsy done in a doctor's office with a scope down your throat, but that's not the best way to do it. Just get a blood test done if the dietary restrictions don't work.
Minnie presented in my office complaining of a painful bunion deformity. A bunion deformity is that deviation of the great toe where you see that bump on the side or bump on the top. It has to do with a deviation of the first metatarsal, and basically, you know, it just became really painful for her to walk in her regular shoes.
Yes, because I really had this bunion, I think like probably about a year. And so it had got so bad I couldn't even wear a shoe, so that's what really made me came in, you know, to have surgery on it.
The next step was for us to take an x-ray and to evaluate her foot and determine what kind of, you know, surgery would be appropriate. So after looking at an intermetatarsal angle, we basically decided that an Austin bunionectomy would be the best procedure. And so that's what we ended up doing.
After I had the surgery, I felt much better, you know, no pain, you know, it just felt better. And I was so happy, you know, to get it done.
I mean, as long as you address the underlying etiology, the cause of it, then you're not going to get a recurrence, and it's wonderful. I mean, you know, people suffer from painful bunions all the time. It can be painful to the point that you can actually develop an ulcer at the side bump, because first it gets red, and the next thing you know, you have a wound. And that can be problematic because then you can get an infection to the bone.
I mean, it's not sore or nothing, it just feels better. And so he really do a good job, and he makes me feel comfortable. I mean, he's a real good doctor.
Bunion surgery has a bad knock to it. You know, a lot of people are concerned that they've heard from their neighbor, or they know someone at work who's had the surgery and it's extremely painful. I have some patients that have zero pain from the bunion surgery, but I can keep the area numb for 3 days with a pain pump, which is a device that just gives continuous drip of local anesthetic and keeps it nice and numb. Because really, inflammation is the first part of wound healing, and that's in the first 72 hours, so the first 3 days. It's a great relief for patients. Really, 2 weeks of just not putting weight on it, and you know, we've really come a long way with our surgeries.
A smile can make a huge difference in one's self-esteem. Now, if you're unhappy about your smile, then you should watch this next segment. Up next, we're going to introduce cosmetic dentist Dr. Guy Lewis.
Well, the spa dentistry concept is something that I am considered one of the pioneers in the spa dentistry field, because I started doing this probably about 20 years ago. It feels like a high-end spa. It feels more aesthetically pleasing. One of the things we started with was just, you know, how the staff was dressed. A lot of them we dress in black, which is a little classier looking. When you walk in, you know, you can tell you're not in your typical dental office. I mean, most people are like, wow, this is unbelievable, because it's very nice. It's kind of like walking to someone's living room. The rooms that I treat patients in are more like suites. They're big rooms. They're not real closed in. They have couches in them so that family members or friends can come in and sit and be with them if they want to. But we also have TVs that are not only up in front of you where you can see them when you're sitting up in the chair, but we also have TVs in the ceiling so that when you're laying back in the chair, they're flat-mounted large screen TVs so you can watch TV, watch a movie, be relaxed, have your own headset, kind of go away, not have to hear all the sounds that are going on. We also have massage therapists that could do foot massage or hand massage, hand paraffin treatments for ladies, especially. Guys like it too, but where they can dip their hands in the hot paraffin and get that done. Just little touches that make it different, make it more of a relaxing experience. You know, most people equate going to the dentist like a trip to the dungeon, you know, and it just doesn't have to be like that. It can be nice, it can be comfortable, it can be actually relaxing. And we have a lot of patients who tell us, you know, I love coming here and I love getting this done. It's no big deal. It's not like, you know, I heard my parents talking about. This is totally different. So we've done a lot of different things to try to make it different from just the norm and different from what everybody else is doing, and make it special, make them feel at ease.
BestDocsNetwork.com also has a video library of all the doctors' videos that you can break down by doctor, topic, and specialty. This is a great way to find videos quickly and watch all the videos associated to your needs.
Carla has a question for Dr. Peter Morgan. What are the causes of venous insufficiency?
The risk factors or causes of venous insufficiency are, first of all, genetic or hereditary. Patients that have parents or grandparents or aunts or uncles that have large varicose veins are more likely to have disease that is caused by a genetic predisposition for the veins to get larger. The second risk factor is lifestyle issues, including jobs, occupations, or hobbies that result in standing or sitting for long periods of time.
As you get older, sometimes you have trouble finding words. So my daughter got all worried, so she'd maybe go to a neurologist. So he does his thing. Go back later, he said, it looks like you had a couple small strokes. They're small, they're not going to bother you. But, he says, you need to go to a cardiologist to check out your heart, just to be on the safe side.
Valvular heart disease encompasses many different entities. The heart has 4 different valves, and Gary Singerman had actually infection and rupture of his mitral valve, which is a very important valve separating the top and bottom chamber of the left side of the heart.
So she sent me to Houston Northwest Hospital, where she had them ordered ultrasound for me. You know, I feel fine. Can I go home now? So my wife and I are sitting there, and she comes in with this film of the ultrasound. She says, could you see the mitral valve there? I said, no, I'm not trained for that. She points with it to her pen and says, right there, it's hanging down in the ventricle. It's been ruined with the bacteria, and it's not doing anything. And so she says, within a month, you're going to have a massive heart failure. And I heard my wife gasp, and I got rocked. I said, wait a minute, I feel fine. She said, I'm checking you into the hospital right now.
Mr. Singerman had mitral valve prolapse, therefore the valve was not closing properly, was redundant and thick, and therefore it was easy for bacteria to stick to that valve and cause infection. And this happened before I met him, and his story is quite interesting, how he came to me. He immediately needed surgery because his valve was infected and ruptured and not working at all. But he's very thankful that he came because we were able to save him.
Obviously, I lived, but the point is I may not have if Dr. Verghese hadn't caught that ruined mitral valve, and so I owe her.
Thank you everyone so much for joining us on another episode of Best Docs Network, featuring some of the best doctors right here in your area. For more information on the doctors you've seen on today's show, head to our website, bestdocsnetwork.com. We love hearing from our viewers, so if you have any questions or comments, feel free to email us at info@bestdocsnetwork.com. I'm Carla Macias, and we'll see you next week.